Today's topic is continuation of the antimicrobial drug. Now we are discussing about the prophylaxis uses of the antibiotics, microbial drugs, and here the prophylaxis agent specific organism. This is general in the highly satisfied, and the choice of the drug is clear cut because it is the targeted rheumatic fever. A long-acting penicillin G is the drug of the choice for the preventing infection uh, by group A streptococcal, which causes recurrence. Now tuberculosis, uh, children, HIV positive and others susceptible context of open cases needs to be protected. Now mycobacterium avium complex MAC HIV/AIDS patients with low CD4 count may be protected against MAC infection by the azithromycin. HIV infection healthcare workers exposed to blood by needles, sticks injury into the protected by the zidovudine and the plus the limivudine or individuals. The meningococcal meningitis during and the epidemic, especially in contains rifampicin and sulfapyridine and septic zones may be used. Gonorrhea, syphilis before on the immediately after contact, ampicillin and septic germs. Recurrent genital herpes simplex acyclovir prophylaxis may be given. Malaria, travelers to endemic areas with high transmission rate may be covered by the mefloquine. Influenza A2 during and the epidemic, especially in cholera, tetracycline prophylaxis may be given. And whooping cough, non-immunized child contact during the incubation period. And plague, doxycycline prophylaxis is recommended. And pneumocystic xylovirus pneumonia transmitters and recipients. Now second is the prevention of the infection in high risk situations such as of AMS may be valid and satisfactory in certain situations. Dental extractions, tonsillectomy, endoscopic causes damage to the mucosa harboring bacteria and induce bacterium. Subjects, but it those with the valvular effects. Now catheterization and instrumentation of urinary tract prophylaxis with the cortimazole, and it is decrease the risk of urinary tract infection. The prevent recurrence of the urinary tract infection in the patient with the abnormalities of the tract. Cortimazole or the notrifluoride may be given. Chronic obstructive lung disease, chronic bronchitis and ampicillin doxycycline ciprofloxacin has been used for the prevention of acute exacerbations. Immunocompromised patients, penicillin, cephalosporin are given to the prevention of the respiratory tract infection. Prophylaxis of the surgical site infection. Surgical site infection includes superficial incisional infection, stitch abscess, deep incision infection, soft tissue, and organ sepsis infection. The purpose of the surgical prophylaxis is to reduce the incidence of SSI with the minimal alterations of the normal microbial flora of the cost of the minimum absorption effect. Wound infections occur due to the microbial contaminant of the surgical site. It is important for the surgery to see that the wound left um, after surgery does not get infected. Use of the sterile instruments, cross infection control measuring is a good surgical technique to minimize tissue damage, hematoma, and devascularization of the primer. And this is the figure of the classification of the this is the table of the classification of the operative wounds with the increasing risk of the infection. Here the measure is a clean, contaminated, and contaminated and dirty. There is a four criteria where the increasing risk of the infection. Read briefly. Now, incidence of the post-operative infection is higher when a surgery had lasted 2 hours or more. Prophylactics should be given for the surgery in the which is the prosthetics is inserted into the bone. The selection of the drug dose, timing, and the duration of the prophylactic medication is crucial. It is important that the antibiotic is not started. Now, here the to be maximum effective, relative high dose of the NA is selected which help peak blood flow several times higher than L peaks and blood level several times higher than the MIC. Dirty contaminants wounds, the antimicrobials generous administrative for 5 days in cases of the contaminated dirty wounds. Here we are is using cephalosporin. Second is cefoxitin and clindamycin, ampicillin, gentamicin, metronidazole. This kind of drug is used, amoxicillin. This kind of drug is used for the control the infection. Here the table is the commonly used antimicrobial drugs for the surgical prophylaxis. You can read for that. Prevention of the infection in the general. This is the highly unsatisfactory in most cases and must be combined condiments and neonates, especially after the prolonged instrumental deliveries, to prevent postpartum infection in the mother after normal delivery, viral upper respiratory tract infection to the prevent secondary bacterial invasions, to prevent respiratory infection in unconscious patient on the other respirators. Antimicrobial prophylaxis in these situations may be hazardous infection by the resistant organisms, fungal and other superinfections can occur. Failure of the antimicrobial therapy. The success of the antimicrobial therapy can be measured either clinically in the terms of the improvement in the symptoms, signs, and microbiological as eradications of the infection organism. Antimicrobials may fail to occur on the infection. Fever on other may be relapse. This is rare when the antimicrobial therapy was begun in the first place on sound clinical and or bacteriological basis, where a real or apparent failure of the antimicrobial regime occurs. The diagnosis and the therapy should be viewed on of the following causes will usually be identified. An improper selection of a drug dose, route, or duration and of treatment. Treatment begins too late. The failure to take necessary adjuvant measures. For the example, drainage of the abscess, empyema, removal of the renal stone and other foreign bodies, or infected gallbladder, adjustment of the proper urinary pH in the cases of a UTI, cavity closure, control of diabetes, poor host defense as in the leukemia, neutropenia and other causes, and especially if a bacteriostatic AMA used. Infecting organism present behind barriers such as vegetations in heart walls, inside the eyeballs, brain barrier, and trying to treat untreatable infections or their causes of the fever, malignancy, collagen disease, and untreatable is viral infection. Here the presence of dormant or altered organisms, the persisters, which later gives rise to the relapse.